this is Dr. Martorell. I am going to be discussing urinary tract infections in adults. Urinary tract infections, or UTIs, are infections that affect either the bladder or the kidneys or both, or the organs that are associated with the urinary tract system. Bladder infections are more common than kidney infections. They happen when the bacteria get into the urethra and travel up into the bladder. The medical term for a bladder infection is cystitis. Most of the time when people talk about a UTI or a urinary tract infection, they mean a bladder infection. Kidney infections are more serious, and they happen when the bacteria travel higher up into the kidneys. The medical term for a kidney infection is pyelonephritis. It's more serious than a bladder infection. It can lead to serious problems, especially when the germs keep spreading to the bloodstream. It may cause sepsis. Both bladder and kidney infections are more common in females than males, and the risk of a UTI or a urinary tract infection is higher in people who have a urinary catheter or may have kidney stones or may have obstructions for different reasons. The symptoms of a bladder infection. Some people have no symptoms. Some people may have one symptom. Some people may have a combination of symptoms. Sometimes it may be mild. Sometimes they may be more significant. But for the most part, they include pain or burning when they urinate, the need to urinate often or frequency, also urgency. They need to urinate like suddenly or right away or in a hurry. And then sometimes blood in the urine. The symptoms of a kidney infection include the same, but usually it includes fever, and it can be a fever of 99.9, back pain or flank pain, and that reflects the involvement of the kidney, nausea and or vomiting, chills, sweats, not feeling well, weakness. So how does someone find out that they have a urine infection? Many people do not need further testing. They develop symptoms and they get treated, gets better, and that's it. Now, some people may need a urinalysis and a urine culture. The urinalysis, when there is white blood cells, it may suggest an infection. White blood cells fight infections. The urine culture, especially depending on the amount of bacteria that is found on the urine culture, is helpful, especially not only determining the germ, but also the best antibiotic use, and also the length of treatment, because it depends on the germ and the antibiotic that is being used, how mild or severe the symptoms are, if it involves only bladder and or kidney, or if it has spread to other parts of the body like the bloodstream. But for the most part, if it is caused by a bacteria, which is the most common cause, it's usually an antibiotic. And again, the antibiotic will depend on all of those factors that I mentioned before. It could be an antibiotic like macrobid, trimethoprim, Bactrim, fosfomycin, Keflex. In more complicated situations, usually ciprofloxacin, levofloxacin, sometimes intravenous antibiotics if the person needs to be in the hospital. And how long? So it may be one dose, it may be 3 days, it may be 7 days for simple cystitis or simple bladder infections. When the kidney is involved, it usually requires 10 to 14 days of antibiotics if it is the first infection or if it is an infection that has recurred. The symptoms usually improve within the first or second day. If the symptoms do not get better or the person keeps getting recurrent infections, then they may need additional workup to make sure that there is nothing else going on, like a kidney stone, obstruction, enlarged prostate or prostatitis, things like cancer, and they may need, an ultrasound, a CAT scan, cystoscopy, or other diagnostic modality to help figure out what is going on, what is causing it, and why people keep getting more urine infections. Some people may be genetically predisposed to urine infections, and besides the use of antibiotics, People may need to drink higher amounts of fluids or water if possible to flush the system out and to keep themselves hydrated. Females, vaginal estrogen shows, and it has been shown to help. Also, avoiding spermicides may be helpful in preventing further urine infections. Urinating after sex. Some providers think that this may be helpful because it helps to flush the germs that might get into the urinary system during sex. There is no real proof that that works, but it cannot hurt. If people get a lot of bladder infections, the doctor or provider may use prevention antibiotics, and that could be a daily antibiotic to prevent infection from coming back. It could be an antibiotic that the person starts to take as soon as they develop an infection, or it could be episodic. If the person develops urine infections when they are sexually active, then they can take the antibiotic right away. There is not really much evidence that cranberry use helps, but for the most part, it will not harm either. Just make sure that the cranberry juice is not interacting with any medications that you may be using, and always run it by the provider. Supplements like mannose or vitamin C or probiotics, some people use them. There is not strong evidence that it helps, but again, for the most part, they are not harmful either. Run it by your provider. I hope that this information was helpful. I will be discussing more complicated urine infections another day. Thank you. Share and like my social media pages. Have a nice day.